And now we tackle a health issue that affects millions of men, but is often left unspoken: erectile dysfunction. More than just a quality of life concern, ED can be a window into broader health issues like cardiovascular disease, diabetes, and even mental health struggles. To help us better understand the causes, symptoms, and the range of treatment options now available, we're joined by one of the leading voices in the field, Dr. Paul Yonover, nationally recognized urologist and men's health specialist. Dr. Yonover has been at the forefront of innovative treatments for patient-centered care when it comes to male sexual health. Dr. Yonover, welcome back to the newsroom. It's always great to have you here.
It's great to be here. Thank you very,
I'm
very
girding my loins,
much.
but we are committed to demystifying and having these conversations.
Absolutely, and I think that's a huge service you're doing for your viewers, because I think demystifying this is really important. This is a serious health issue that goes unspoken because patients don't bring it up to their doctors, and doctors don't bring it up for their patients, particularly primary care doctors. And so I love being able to discuss this with you and for your viewers, because there's not only really good information here, but things that people don't think about and should hopefully prompt people hopefully to open up that discussion either with their partner or their physicians.
Yeah. And if the numbers we just talked about from the opening of this are true, there should be more conversation about this. Someone watching at home is going to get information tonight that's going to be incredibly important to them, we hope. But let's start with the basics. What exactly is erectile dysfunction, and how common is it among different age groups of men?
Sure. So the classic definition is the inability to either obtain or maintain an erection sufficient for sexual intercourse. And there are different types of sexual intercourse, and the erections, you have to be able to get one, but also be able to keep one. And as I talk to patients about, I go through all the different phases of sexuality, and I do that both to set the table, get a vocabulary going, also breaking down some barriers, making a patient feel comfortable. This is an intimate setting in a doctor's office, but patients are reluctant, it's embarrassing, patients are confused, or they don't have the vocabulary.
Sure.
So it's we typically use the word obtain, getting the erection, and maintaining, being able to keep the erection, and then there's the quality of the erection. Those are the things that are important to discuss. That's where urologists, people who deal with male health, that's where we can do the most to help patients. Then of course there's libido, the sex drive. That's much more a hormonal and psychological issue. And then there's orgasmic issues. And as I said, I take patients through the sort of sexual arc so that they understand what we're talking about, and then I start probing and asking the questions to elicit that from the patient.
And to your point, many people, myself included for a good while, thought of ED as strictly sexual health issue. But you've spoken about its connections to other issues. We talked about it in the opening. What are some of those, give us a deeper dive on some of those other underlying issues that could lead to ED?
Sure, and I think that's, if anybody, the takeaway point from today isn't just about erections, but it's about all the tangential issues it touches, because it is a harbinger of health for the patient. Right? We call it the canary in the coal mine. If you can't get an erection, it is very likely that there are other, what we call comorbidities, other issues going on, either known or unknown. And it's the unknown ones that we're actually most concerned about. But you asked about the prevalence. My clinic is filled with patients, both young, middle-aged, and old, who come with various sexual issues.
So this isn't a 60-year-old man's problem exclusively?
No, and I think that's the thing that is one of the misinterpretations, misunderstandings in the public, right? I saw a patient today in clinic who was in his early 30s. And, a part of a urologist's job is to tease out, is this a psychogenic, something that's either depression, anxiety, or other psychological input? Is it a hormonal issue, such as low testosterone? Is it a thyroid problem or other hormonal issues? Or is it other things like early onset diabetes or vascular disease? Now, this young man, we're still in the early stages of figuring this out, but when I have men in their 40s and 50s, particularly men who are smokers, they're overweight, they have hypertension, they have large waist sizes, they have high cholesterol, high triglycerides, they have
That impacts.
Absolutely, to a tremendous degree. And in fact, as a urologist, I'm dealing with urologic issues, but it is more often than not when I'm dealing particularly with male health issues is when I start to either uncover or discover other major life-threatening medical problems that were either undiagnosed or really untended to. The penis is a vascular organ. In order to get an erection, you have to have neurologic intact signaling, but you also have to have the arteries open up and the veins collapse. And if you can't do that, that may be a sign that the arteries are not sufficiently flowing blood in. And if you can't do that, as I say to patients, listen, perhaps you have the same issues with the arteries that go into your brain and to your heart.
I'm thinking that as you're talking.
Absolutely. In fact, my biggest worry for my patients who are sort of mid-40s to mid-60s is that they have some occult or undiagnosed or silent cardiovascular disease. So I'm actually very aggressive when I'm talking to patients about talking not only about the more obvious things, smoking, weight loss, blood pressure control, sugar control for diabetes, but I start asking about family history. Because it is not uncommon that I find patients who have a strong family history of heart disease, and I end up screening them and finding significant cardiovascular disease that went undiagnosed. And as I say to them, as I said earlier, if you can't get blood flow to the penis, you may not get blood flow to your heart. And
so my penis could have saved my life.
Absolutely, and it's not uncommon that that occurs.
So let's talk about the range of treatment options available now, from devices to surgery. How do you go about determining which treatment or suite of treatments work for which type of patient? Well,
the first thing is to do a thorough history and physical exam, uncovering all the issues we just talked about, and controlling diabetes and blood pressure, getting a patient to quit smoking. That's key and a cornerstone. But once we determined what's going on, you always want to go from most conservative to most, and work your way towards more invasive therapy. So the mainstay of erectile dysfunction therapy, most of your viewers, I think, will probably be aware of the oral medications, Viagra, Levitra, Cialis. They're very effective, they're very safe. There's a small population who shouldn't be on those medications, particularly patients with known heart disease or taking a medication called nitroglycerin. But there are two therapies that I use often for patients who can't take the medicine or if it doesn't work. If I may, I was taught as a kid if I'm invited,
show and tell, aren't we?
If I'm invited to a party, I shouldn't come empty-handed. And so, because my mother taught me well, I thought I would bring a prop, because I'm known for my props here, and I'm allowed to do this because I'm a professional.
You're a professional.
So I have this actually in my office, and it's actually one of the props we use to sort of get patients talking.
To demystify.
To demystify. Okay. So one of the options, if the pills don't work, the two main options a patient has is you can actually inject medication into the penis. It's much easier than it sounds, and it's very effective for many of my patients, and it's life-changing, right? Because if the pills don't work, you still can get and maintain an erection for sexual function. And so what we do, I teach patients how to do it. You do it at home, you do it to yourself, or your partner does it to you. It's much easier than it seems, and I actually show patients in the office how to do it so that they can get over the sort of the fear factor.
Sure.
But you basically draw up medicine just like this very small needle. And in fact, many of these patients are diabetic, so they're used to drawing up medicines and having small needles. It's actually a very small needle. The patients inject, and I'll do it for the camera here, literally right into the penis, inject the medicine, remove the needle, and within 5 minutes have a very natural physiologic erection. And it restores sexual health for a lot of patients. It's really pretty amazing.
How long does it last, and how often do I need to take the shot?
A great question. So it just replicates the normal function. You get the erection, you have sexual intercourse of whatever kind, After ejaculation, the erection goes down. There's a couple risks with this, but at the end of the day, it's very safe. It can only be done once a day, and we tell patients no more than really 3 or 4 times a week. If this doesn't work, or if patients can't or won't be able to do that, there's actually a surgery that we can do to restore erection function. It's much more involved. It's the kind of thing you have to have a very motivated patient. You have to have a healthy patient, right, who can handle the surgery. But the important thing, I think, for your viewers is not to despair. Sexual health isn't just something that should be taken for granted. It is not just a quality of life, it's part of life.
Yeah, and again, for better or for worse, for a man, it carries such, forgive any pun, weight.
Absolutely.
From my own personal experiences, when that is part of the conversation, it's such a core of what you believe anyway is your identity. It's difficult. So what advice would you give men who are reluctant to come in and have this very important but tricky conversation that brings up so much in us? Like, we talk about our manhood.
Absolutely.
So what advice would you give to a patient of how to even broach this conversation with their doctor?
Well, I mean, everything you touched on is absolutely spot on. It is part of our identity. It's also very anxiety provoking and can be very triggering. So I would advise your viewers to open up the dialogue with their physicians if they're struggling, and that they can get a referral to a men's health specialist like myself. There are lots of therapies, but I think understanding they're not alone. There's a lot of men in the same boat, even young men.
Yeah.
And I think the other important piece is if you get it checked out, you may uncover some health issues that will be life-changing. But also we have a whole host of very effective therapies to restore not just your sexual health, but your identity, your manhood, and your sense of wholeness. Yeah. And I think that's something that if people really think through, they'll get the motivation.
It's worth the slight embarrassment to have the result.
Absolutely.
Dr. Yonover, as always, you continue to come on here with your skill sets and props, and I'm smarter after every conversation, slightly unnerved after some conversation, but that's not here nor there. These are important conversations to have. So thank you. We'll have you back again soon. You know
Wonderful.
that. On the other side of the break, we'll talk about one of my most favorite celebrity humans, Dolly Parton. Stick around and hear why I love Dolly and the incredible work happening at Share Our Spare on the other side of the break. Stay with us.